So, who gets to decide what's good for your health? Is it you, or is it the government? I mean, this question is right at the heart of so many debates we're having today, from what's in our food to the shots we get. In this explainer, we're going to dive right into that constant tug of war between our freedom to choose and what's good for everyone. And really, think about it for a second. You see it everywhere. Should there be a tax on sugary drinks? Should smoking be banned in parks? Should certain vaccines be required? Every single one of these policies forces us as a society to try and answer that exact same question. And here's why it's so incredibly tricky. We're basically balancing two of our most fundamental values, and they're often pulling in opposite directions. In one corner, you've got individual freedom, the right to live your life your way. And in the other corner, you have the public good, this idea that we all have a shared responsibility to keep the community healthy. Every single public health policy is like a tightrope walk between these two. Okay, so to understand this debate, we've got to start with an idea from the philosopher John Stuart Mill. It's called the harm principle. And in a nutshell, it's pretty simple. The government should only step in and limit your freedom to stop you from hurting somebody else. That's it. Just protecting you from yourself, that's not a good enough reason. And Mill summed it up perfectly with these famous words. This single idea that you, and only you, are the ultimate ruler of your own body and mind has been the absolute bedrock of how we think about personal freedom for more than 150 years. But here's the thing. In our super complex modern world, that principle starts to show some cracks. It's great for stopping one person from, say, punching another, but what about more complicated stuff? Like massive health inequalities between rich and poor, or the fact that our choices are constantly being shaped by billion-dollar advertising campaigns. The harm principle alone just doesn't give us a clear map for navigating that. And that's where a more modern framework comes in. It's called the stewardship model. This idea says the government isn't just a referee waiting to blow the whistle when someone causes harm. No, it's more like a steward or a caretaker who has a responsibility to create the conditions where everyone has a fair shot at a healthy life. So what does that actually mean, being a steward? Well, it's a much bigger job. The government now has a duty to actively promote health, to protect vulnerable people like children, and this is really crucial, to step in and try to shrink those health inequalities we talked about. The focus totally shifts from just preventing harm to actively enabling health. And if you need a reason why that goal is so important, just look at this. This isn't just a statistic. This is about real kids. Children in the most deprived areas are hospitalized for lung infections at twice the rate of kids in the wealthiest areas. The stewardship model says a just society simply can't ignore that. It has a duty to act. Okay, so the state has this bigger responsibility, which brings us right back to our original problem, doesn't it? If the government is going to step in, how does it decide how far is too far? How can it possibly create policies that work and that are also ethically sound? Well, there is a tool for that. It's called the intervention ladder. Think of it like a ladder for policymakers. Down at the bottom, you have the hands-off stuff, like just providing information. But as you climb up, the actions get more and more restrictive. And here is the golden rule. The higher you climb this ladder, the more powerful, the more compelling your ethical reason has to be. All right, enough with the theory. Let's see how this ladder actually works in the real world. We'll start with an easy one, infectious diseases. This is a classic case where that harm to others idea is crystal clear. So let's take vaccine policies. A low-rung approach? That's just education campaigns, encouraging people to get a shot. Easy enough. A middle rung might be offering incentives to get more people vaccinated. But a high-rung policy, like saying kids can't come to school without certain vaccines, whoa, that's a major restriction of choice, and it needs a really strong justification, like preventing a dangerous disease from sweeping through an entire community. And then you get to the very, very top of the ladder. Here you find things like quarantine and isolation. I mean, these measures completely eliminate personal choice. The only way to justify something this extreme is by leaning almost entirely on that original harm principle. The threat to others has to be so significant, so direct, that it outweighs this massive loss of freedom. Okay, so infectious disease is a fairly clear-cut case, but now let's tackle something much more complex: obesity. This is where those lines between personal choice and public responsibility get really blurry. First, just look at the scale of the challenge. Obesity rates have tripled in just a few decades. Now, when you see a trend that big, that fast, you know it isn't just a story about a few people making bad choices. It points to something much bigger, something systemic in our environment. And this leads us to the absolute core of the ethical debate around obesity. Is this purely an issue of individual willpower? Or have things gotten to a point where we have to see it as a public problem that demands a public, coordinated response? This is where the stewardship model really helps us think more clearly, because it recognizes that this simple idea of choice is often, well, it's kind of an illusion. I mean, can you really choose to eat healthy if there are no affordable, fresh foods in your neighborhood? Your choices are always limited by your environment, your income, and by a constant barrage of marketing. So, an ethical policy response would use the entire ladder. Down at the bottom, you have simple things like clear food labels. You move up a bit, and you have policies that enable healthier choices, like building cities with more parks and bike lanes. And then at the higher end, you get more protective measures, like restricting junk food ads aimed at kids, who are a vulnerable group. But, and this is a really big but, there's a huge ethical warning sign here. Whatever policies are put in place, they absolutely must avoid shaming people or blaming them for factors that are way outside their control. It's a critical part of practicing public health ethically. You can't punish people for the environment they happen to live in. So we've walked through this central conflict, a modern framework for thinking about it, and a practical tool for putting it all into action. So, what's the big takeaway for you? Okay, let's boil it all down. First, public health will always be this tricky balancing act between your freedom and the community's health. Second, the stewardship model gives us a new goal: to create a society that actually helps people be healthy. Third, the intervention ladder is our practical guide for figuring out how to do that. And it all comes down to that one golden rule. The more policy takes away your freedom, the stronger its justification has to be. So I want to leave you with this. This isn't just some abstract theory. You now have a toolkit to analyze health policy. So the next time you hear about a new rule, a sugar tax, a smoking ban, whatever it is, don't just have an opinion. Ask yourself, okay, where does this policy sit on the intervention ladder? And is the reason for it strong enough to justify that wrong?